Hi everyone, I am Noor Akhtar. I think already you know me from the lab of the cross anatomy, and I'm going to give you the narration with the PowerPoint slides of my pelvis perineum lecture. And before I go with the PowerPoints of all the lecture slides, I need to tell you some introduction about these things because pelvis perineum is actually a little bit difficult. I don't want to scare you, but it's a little bit difficult. But because it's in a small area, you will see there are lots of structures in a small area of the pelvis. So you need to try to see in the lab everything in the cadaver, and please try to study with the models and also in the cadaver, so that's how you can get an impression of how the 3D structures are visible in the pelvis and perineum, because in the books you can see the images, but I think the 3D images are much better learning tools than the book images. Okay, and also in the pelvis perineum section you need to study male and female, both sexes. So you need to concentrate on the male pelvis, male perineal structures, and female pelvis, female perineal structures. Okay, I'm going to start with the pelvis. So pelvic girdle, like the shoulder girdle you have seen in the upper limb, it is a basin-shaped bony ring formed by the union of the two hip bones. The two hip bones united anteriorly by a cartilage which is called pubic symphysis, and posteriorly the two hip bones are articulated with the sacrum. Sacrum is formed by the fusion of the 5 sacral vertebrae, and you can see superiorly it articulates with the 5th lumbar vertebral bodies, and the sacrum, the superiormost part of the body of the first sacral vertebra, is called sacral promontory. And on each side of the sacral promontory, this superior surface of the sacrum is the ala of the sacrum. The ala of the sacrum and this part of the sacrum articulates with the ilium of the hip bone. And this joint in between the sacrum and ilium is called the sacroiliac joint. So posteriorly, the sacroiliac joint, and anteriorly, the anteroinferior part of the hip bones are called pubis, and both sides pubis articulates with each other by a cartilage which is called pubic symphysis. Inferior to the pubic symphysis, see, this is the inferior ramus of the pubis, and this angle inferior to the pubic symphysis in between the both sides inferior pubic ramus is called the subpubic angle or pubic arch. Excuse me. And this pelvic girdle, which is formed by the union of the two hip bones, sacrum, it carries up our body weight during standing and sitting position. Our body weight is transmitted from the vertebral column through the sacrum, then through the sacroiliac joint, through the hip joint. Hip joint is in between the hip bone and the head of the femur. And this pelvic cavity in between the two hip bones, this is from the pelvic cavity. It has a pelvic inlet. The pelvic inlet is this bony boundary. See, all these bony boundaries. I will tell you about the details of the pelvic inlet, and inferiorly there is a pelvic outlet. See, in this slide you can see this is the posterior view of the pelvic cavity. So this is pelvic outlet. So inlet is the entry point of the pelvic cavity and outlet is the exit point of the pelvic cavity. So the pelvis is formed by the union of the two irregular shaped hip bone. Each hip bone has three different parts. The superior large broad part is called ilium or ilium, and then the posterior inferior part is the ischium, and anterior inferior part of the hip bone is the pubis. These three different parts of the hip bone, they unite with each other on the lateral side of the hip bone by a cup-shaped bony depression which is called acetabulum. Acetabulum is a hollow on the posterolateral side of the hip bone which articulates with the head of the femur and form the hip joint. And in this acetabulum you can see there is a Y-shaped cartilage. Before the age of 16, there is a Y-shaped cartilage. Before the fusion of these three different parts of the hip bone, there is a cartilage which fuses approximately in between 16 to 18th years of age, and then after fusion it forms the hip bone. So the superior large part is called the ilium, and ilium, see, it has an iliac crest superiorly. The iliac crest ends anteriorly by the anterior superior iliac spine, and posteriorly there is a similar posterior superior iliac spine. And on the lateral side of the ilium or posterolateral side of the ilium, there are three gluteal lines. In between these gluteal lines, the large gluteal muscles are attached in this gluteal surface which is on the lateral side of the ilium. And ilium, it has a body inferiorly which forms the superior part of the acetabulum, and the body of the ilium fuses with the body of the ischium. And along the posterior border of the ilium and ischium, this indentation, see, there is a notch which we call the greater sciatic notch. And ischium is the posterior inferior part of the hip bone. Ischium has a body. It has a rough, elongated, large bony prominences on its posterior inferior aspect, that is called the ischial tuberosity. And it has a ramus. The ramus of the ischium joins with the inferior ramus of the pubis, and that forms the anterior-inferior boundary of the obturator foramen. See, obturator foramen is in between the pubis and ischium. Ischial tuberosity is an important bony prominence. When we sit on the ischial tuberosities, and our body weight is transmitted through the ischial tuberosity into the surface. The anterior inferior part of the hip bone is called the pubis, which has a body, and it has a superior ramus and inferior ramus. Superior ramus, it forms the anterior inferior part of the acetabulum. Inferior ramus, already I mentioned, it joins with the ramus of the ischium, and this joined part of the ramus of the ischium and inferior ramus of the pubis, this is called ischiopubic ramus. See, this is the pelvic surface of the hip bone. On the pelvic surface of the ilium, there is a fossa, iliac fossa. And this part of the ilium is called ala, or the wing of the ilium. Iliac fossa is smooth for the attachment of iliacus muscle. And anteriorly, you can see the anterior border of the ilium has the anterior superior iliac spine. Also, it has anterior inferior iliac spine. And also on the pelvic surface, there is a line over the ilium that is called arcuate line. And this arcuate line is continuous with a sharp crest on the superior ramus of the pubis, which is called pectineal line or pecten pubis. And posteriorly, you can see along the posterior border, already I mentioned that there is a notch, the greater sciatic notch. And ischium has a sharp bony projections along its posterior border at the junction of the body and the ischial tuberosity. This sharp bony prominence is called ischial spine. Inferior to the ischial spine, the posterior border of the ischium has the lesser sciatic notch. So ischial spine lies in between the greater sciatic notch and the lesser sciatic notch. So pelvic cavity. In this illustration, you can see pelvic cavity is continuous superiorly with the abdominal cavity. Abdominal cavity extends from the respiratory diaphragm. Abdominal cavity extends from the respiratory diaphragm superiorly, and inferiorly it continues with the pelvic cavity. And the pelvic cavity is it's situated at the posterior inferior side of the abdominal cavity. See, the sacrum has a curvature, and the pelvic cavity lies a kind of posterior inferior to the abdominal cavity. And abdominal cavity is continuous with the pelvic cavity. So that's why we call together abdominopelvic cavity. And you can see there is a line or ridge, the pelvic inlet, which we called pelvic inlet. And pelvic inlet divided the pelvic cavity into two different parts. Superior to the pelvic inlet is called the greater pelvis, and inferior to the pelvic inlet is called the lesser pelvis. And the pelvic cavity, inferiorly, it has the pelvic outlet, and the pelvic outlet is closed by a musculofascial diaphragm, which we call pelvic diaphragm. See, in this picture, you can see half of the pelvic cavity, and you can see this line. This line is called the pelvic inlet. So pelvic inlet is formed by the sacral promontory posteriorly, then the ala of the sacrum, sacroiliac joint, then this arcuate line, which is continuous with the pecten pubis or the pectineal line, and then the pubic tubercle and pubic crest, and upper border of the pubic symphysis. And together with the opposite side hip bones, it forms an oval shaped ring, which we call the pelvic inlet or pelvic brim. And pelvic inlet is the boundary. So this is the pelvic inlet. See the hip bones on the lateral side of the pelvic cavity. So this is the line. If we connect the line of the pelvic inlet, see, superior to the pelvic inlet, this part of the pelvis is called greater pelvis. Greater pelvis is also called false pelvis, and greater pelvis or false pelvis is continuous with the abdominal cavity superiorly. And inferior to the pelvic inlet or pelvic brim, this funnel-shaped pelvic cavity, narrow pelvic cavity, is called the true pelvis or lesser pelvis. That is the true pelvic cavity or the lesser pelvis. And the true pelvis or the lesser pelvis is bounded inferiorly. Inferior boundary of the true pelvis is the pelvic outlet. And already I mentioned that pelvic outlet is closed by the musculofascial diaphragm, which we call the pelvic diaphragm. And pelvic diaphragm is formed by the muscles and fascia. And pelvic diaphragm is funnel shaped. See, it is a sling shaped or funnel shaped pelvic diaphragm. Pelvic diaphragm separates the pelvic cavity from the perineum. Inside the pelvic diaphragm, this is called pelvic cavity or true pelvis, and outside the pelvic diaphragm, this is called perineum. This is the posterior view of the bony pelvis. You can see there are several strong ligaments connect the hip bone with the sacrum. There are two important strong ligaments connect the hip bones with the sacrum. One is the sacrotuberous ligament. sacrotuberous ligament. It extends between the sacrum and the ischial tuberosity. And there is another one, the sacrospinous ligament, which lies anterior to the sacrotuberous ligament. You can see this is the medial view, sacrospinous ligament and sacrotuberous ligament. This sacrotuberous and sacrospinous, these two ligaments, these convert the greater and lesser sciatic notches into foramen. See the greater and lesser sciatic notches, they are converted by this sacrotuberous and sacrospinous ligament into foramens. Superiorly, this is the greater sciatic foramen, and inferiorly, this is lesser sciatic foramen. Greater sciatic foramen is, you can consider this as a door or passageway for the blood vessels, nerves, and also a muscle is entering into the gluteal region from the pelvic cavity. So this is an opening or aperture within the pelvis through which the blood vessels, nerves, and a muscle is exiting from the pelvic cavity and entering into the gluteal region, which lies over this hip bone on this gluteal surface. And there is another smaller lesser sciatic foramen, and lesser sciatic foramen, you can consider this as a door or entry point of the blood vessels and nerves, and also another muscle is passing through the lesser sciatic foramen, and all these structures are entering through this lesser sciatic foramen, entering or exiting into the perineum. Greater sciatic foramen and lesser sciatic foramen, you will see all this very clearly when you will see the gluteal region. You will see the blood vessels of the gluteal region and nerves. They are passing or coursing through the greater and lesser sciatic foramen. And there is a blood vessels and a nerve that enters through the greater sciatic foramen, and it crossing over the ischial spine, and it re-enters through the lesser sciatic foramen and enters into the perineum. You can see also here the obturator foramen. Obturator foramen in between the ischium and pubis is closed by a strong membrane that is called obturator membrane, but it leaves a gap or canal which we call the obturator canal. So there are differences between the male and female pelvis, because female pelvis, it carries the child. Female pelvis is carrying the child, and for the childbirth, the female pelvis has some important characteristics or the differences than the male pelvis. So you can see here, male pelvis as a whole, it is stronger, because as a whole, the male muscle, the lower limb muscles which attaches to these pelvic bones or hip bones, these muscles are stronger than the female. So male pelvis as a whole is stronger, much stronger, heavier, and also you can see it is narrower and longer. But female pelvis is wider for bearing the child. It is wider, it is less heavier than the male, and also female pelvis is shallow. And you can see here in the female pelvis, the pelvic inlet and also the pelvic outlet is wider for the childbirth. But in male pelvis, you can see pelvic inlet is narrower and it is heart-shaped. Pelvic inlet is heart-shaped, and also the pelvic outlet is narrower than the female pelvis. Female pelvis, you can see, is wider as a whole. So its subpubic angle inferior to the pubics, this is called pubic arch or the subpubic angle. It is wider than the male pelvis. See, male pelvis, the pubic arch or subpubic angle is narrower, and in the female pelvis, the subpubic angle it's more than 90 degree, and in the male pelvis it is less than 70 degree. It is more, male subpubic angle is more acute, and female subpubic angle or pubic arch is arch shaped or wider. So these are the differences in between male and female pelvis. So please try to see the male and female pelvis plastic models in the lab and try to differentiate it, which one is female and which one is male. Because the female pelvis is wider and shallower for the childbirth and childbearing, the obstetrician, they measure the diameters of the female pelvis. So the diameters are measured through the pelvic inlet and also through the pelvic outlet. See this in this image, you can see this is the line of the pelvic inlet. So pelvic inlet, and this is the pelvic outlet. And pelvic inlet, the diameter measured usually the anteroposterior diameter. The anteroposterior diameter is from the sacral promontory to the superior border of the pubis. And the transverse diameter is the most widest part of the pelvis. Through these two parts of the ilium is measured. And inferiorly, the diameter of the pelvic outlet is measured from the anteroposterior, from the tip of the coccyx to the symphysis pubis, and the transverse diameter of the pelvic outlet is measured in between the two ischial tuberosities. That is the widest part of the outlet of the pelvic cavity. And during childbirth, the coccyx moves backwards, so coccyx is mobile. And because of the hormonal influences, all the ligaments get relaxed and give more room for the childbirth. So here are some basic concepts. I told you that the pelvic diaphragm is a bowl-shaped structure, musculofascial diaphragm, and inside the pelvic diaphragm is the pelvis, and outside the pelvic diaphragm is perineum. So you can see this is the superior view of the pelvic cavity. So see, this is the pelvic inlet. See, this is pelvic inlet, sacral promontory, the arcuate line, and the pubic crest, pubic symphysis, all these are the pelvic inlet. So if you view through the pelvic inlet, this is the true pelvic cavity. And the pelvic outlet, you can see it is closed by this musculofascial diaphragm, which we call the pelvic diaphragm. So you are viewing the pelvic diaphragm from the superior aspect, from the pelvic side, and outside the pelvic diaphragm or inferior to the pelvic diaphragm is the perineum. So see the pelvic cavity, it has lateral walls, it has posterior wall, and it has the floor. This is the floor of the pelvic diaphragm. The lateral wall of the pelvic cavity is formed by this muscle, which is called obturator internus muscle. I showed you the obturator membrane, which closes the obturator foramen, but leaves a canal that is called obturator canal. On the inner side of the obturator membrane, it gives attachment to the obturator internus muscle. And obturator internus muscle has a fascial covering, which we call the obturator fascia, or the fascia covering obturator internus muscle. So obturator internus muscle and its covering fascia, that forms the lateral wall of the pelvic cavity. And the posterior wall of the pelvic cavity is formed by the piriformis muscle or piriformis muscle. Piriformis muscle arises, or it has its proximal attachment on the pelvic surface or ventral surface of the sacrum. And piriformis muscle lies on it, or it forms the posterior wall of the pelvic cavity. And inferiorly, the floor of the pelvic cavity is formed by two muscles. Anteriorly, this muscle, it has three different parts, that is called levator ani. And posteriorly, there is a small triangular shaped muscle is called ischiococcygeus or coccygeus muscle. Levator ani and coccygeus, these two muscles forms the pelvic diaphragm. And obturator internus muscle that forms the lateral wall of the pelvic cavity, and piriformis form the posterior wall of the pelvic cavity. These muscles are not the part of the pelvic diaphragm. Levator ani muscle, it has three different parts, and I think it is not very important to memorize the three different parts of this levator ani muscle. Just for your information, it has a puborectalis, the most medial part. Then it has pubococcygeus, and then it has the iliococcygeus. So iliococcygeus, pubococcygeus, and puborectalis, these are the three different parts of the levator ani. And this levator ani muscle, it arises from a tendinous arc. See, there is a tendinous arc or arch-shaped thickening of the tendons or the fascia covering obturator internus. This is called the tendinous arc of the levator ani. From this tendinous arc of the levator ani, which lies on the fascia covering obturator internus, this levator ani muscle arises from the both sides, and they join with each other, and they surrounded the anal orifice. Anal orifice is or anorectal hiatus is the opening through the levator ani muscle. So pelvic diaphragm is not a solid diaphragm. It has openings in it. So there is a anal orifice or anorectal hiatus, and anteriorly there is another orifice, the urethral orifice or hiatus for the urethra. And this levator ani muscle, it surrounds the anal hiatus, and posteriorly this coccygeus muscle, it arises from the ischial spine, and it is attached to from the ischial spine to the coccyx. Ischiococcygeus or coccygeus muscle form the most posterior part of the pelvic diaphragm. So in the male, through the pelvic diaphragm, there are two openings. One opening is for the urethra, and another opening is for the anal canal. This is the inferior view of the pelvic diaphragm in the female perineum. Superiorly, there is female pelvic cavity. So in the female, you can see this is the levator ani muscle. This is coccygeus, which is attached from the ischial spine to the coccyx. And we are seeing the pelvic diaphragm from the perineal side, from the inferior side. And you can see in the female, there is anorectal hiatus or opening for the anal canal. There is urethral opening most anteriorly, and also in the female there is vaginal orifice. So female has the vaginal orifice, urethral orifice, and the anorectal hiatus or anorectal orifice in the pelvic diaphragm. So pelvic diaphragm is like a muscular ball, and which has a superior surface which is concave, and which superior to that is the pelvic cavity, and inferior surface of the pelvic diaphragm is convex inferiorly, and that is forming the perineum. So perineum is a narrow space. Perineum is a narrow space in between the two thighs. See, in this illustration, you can see in between the two thighs, the perineum is the narrow space. It has bony boundaries. So if we abduct our thighs, this narrow space is called the perineum. And already I mentioned that perineum is outside the pelvic diaphragm. It has bony boundaries. See, this is male perineum, and on this side here is the female perineum. So perineum is a diamond-shaped space. If we consider the bony boundaries, you can see anteriorly the bony boundaries of the perineum is same in both male and female. In the male, anterior boundary most anteriorly is the pubic symphysis. Posteriorly, the coccyx, tip of the coccyx, and on each side by the ischial tuberosities. So if we draw this line from the pubic symphysis connecting the ischial tuberosities, from the ischial tuberosities to the coccyx, if we connect all this, this is the perineum. It's a diamond-shaped space. Diamond-shaped space in between the pubis, pubic symphysis, ischial tuberosities, and coccyx. And again, the perineum is a diamond-shaped space in between the two thighs, and it has openings. See, it has the anal orifice, and also anteriorly it has the urethral orifice, and in the female also it has an additional vaginal orifice. And in the male and female, in both sexes, the perineum is divided into two triangles. If we draw an imaginary line connecting the two ischial tuberosities, anterior to this line, this triangle is called urogenital triangle, and posterior to this line is called anal triangle. Urogenital triangle and anal triangle. And it differs, the urogenital triangle has different structures in male and female, but the anal triangle, it has the same structures, only one orifice, the anal orifice, and it is same in the male and female. Anal triangles are same. So excuse me. So see, the anal orifice is here, and on each side of the anal canal, and this is called external anal orifice. External anal orifice is the center point of the anal triangle. See the ischial tuberosities on each side, and this is the tip of the coccyx. So anal canal is the central point. On each side of the anal canal, there are two wedge-shaped or pyramidal-shaped space. See the pelvic diaphragm. I told you pelvic diaphragm is convex on its exterior side or perineal side. So, and because pelvic diaphragm is convex, it gives rise a space, pyramidal shaped space on each side of the anal orifice. And this space on each side of the anal orifice, in between the anal orifice and ischial tuberosities, we call this ischio-anal fossa. This space is called the ischio-anal fossa. And this ischio-anal fossa is bounded by muscles. It has the pelvic diaphragm muscle, which forms its medial wall, and laterally the obturator internus muscle that forms the lateral wall of the ischio-anal fossa. So you can see here, already I mentioned that the pelvic diaphragm, the levator ani muscle, arises from the tendinous arc of the levator ani. It joins with each other in the midline by a median raphe. So we removed the posterior wall of the pelvis, and you can see from the posterior side, this is the rectum anal canal, and you can see on the lateral wall of the pelvic cavity, this is the obturator internus muscle. And from the middle of the obturator internus muscle, approximately from the middle, from the tendinous arc, this levator ani muscle from the both sides, it's going to fuses with the external anal sphincter muscle. And this levator ani and this obturator internus muscle, in between these two muscles, these spaces, the pyramidal shaped or wedge shaped space is called ischio-anal fossa. Ischio-anal fossa, in between the ischial tuberosities and the anal canal. So one thing is important, that obturator internus muscle, and from the approximately from the middle of the obturator internus muscle, the levator ani muscle arises, and above this levator ani muscle, this part of the obturator internus muscle, that forms the lateral wall of the pelvic cavity. So see, this is inside the pelvic cavity. This is the lateral wall of the pelvic cavity. But external to the pelvic diaphragm or levator ani muscle, this part of the obturator internus, see obturator internus, this is the pelvic lateral wall of the pelvic cavity, levator ani muscle, and below the levator ani muscle, this lateral part of the obturator internus muscle, it forms the lateral wall of the ischial fossa. So the superior part of the obturator internus muscle is within the pelvic cavity, that forms the lateral wall of the pelvic cavity, and inferior part of the obturator internus muscle, inferior to the attachment of the levator ani muscle, that forms the lateral wall of the ischial fossa. So lateral wall of the ischial fossa is formed by the obturator internus muscle. Medial wall is formed by the levator ani muscle. The apex of the ischial fossa is formed by the union of these two muscles. And the floor of the ischial fossa is formed by the skin, superficial fascia, deep fascia. And ischial fossa, see, the major contents of the ischial fossa on each side of the rectum is the fat. And this fat is important. This ischial fossa is full of fat. It gives support to the rectum, anal canal, and also other pelvic organs. And on the lateral wall of the ischial fossa, see, on the obturator internus fascia, there is a canal. There is a fascial tunnel or canal, which we call the pudendal canal. And that pudendal canal, it has pudendal nerve and internal pudendal artery and internal pudendal vein. So you can see here in this illustration, this is the levator ani. So levator ani muscle arises from the tendinous arc of the obturator internus. So this part of the obturator internus is on the lateral wall of the pelvic cavity. And below the attachment of the levator ani, this part of the obturator internus, it forms the ischial fossa, lateral wall of the fossa. And the medial wall of the fossa is formed by the obturator, the levator ani muscle. Medial wall, levator ani, lateral wall, obturator internus. And I mentioned that on the obturator internus muscle, there is a fascial tunnel or canal, which we call the pudendal canal. And pudendal canal contains the internal pudendal artery and pudendal nerve. And the internal pudendal artery, you can see here, it gives rise branches. And these branches are horizontally running and they are coursing towards the anal canal. And these branches of the internal pudendal artery, also they are accompanied with the pudendal nerve branches. And these branches are called inferior rectal arteries and inferior rectal nerves. There are several inferior rectal branches which arise from the internal pudendal artery. Inferior rectal branches of the internal pudendal artery supply the external anal sphincter muscle. So the anal canal, see, this is the closer view, and you can see this is pudendal canal, which is a fascial tunnel on the obturator internus muscle. This is pelvic diaphragm, and these inferior rectal branches going towards the anal canal, and anal canal is surrounded by muscle, skeletal muscle, that is called external anal sphincter muscle. External anal sphincter muscle get the blood supply from the internal pudendal artery branches, and these branches are called inferior rectal arteries. And another important thing is that, so you can see in this illustration, this is levator ani, this is anal orifice surrounded by the external anal sphincter muscle. So levator ani, a part of the levator ani muscle, is continuous with the external anal sphincter muscle. And see, this is the anal canal, and this is external anal sphincter muscle. External anal sphincter muscle is continuous with the levator ani muscle. I mentioned already that levator ani muscle has a puborectalis part. That puborectalis part of the levator ani muscle is continuous with the external anal sphincter muscle. External anal sphincter muscle is a skeletal muscle, and that is supplied by the inferior rectal branch of the pudendal nerve. That is controlled by the external anal sphincter muscle is controlled by the somatic nerve, which is the inferior rectal branches of the pudendal nerve. And you can see there is another muscle inside the anal canal that is called internal anal sphincter muscle. So external anal sphincter muscle is continuous with the levator rani, and internal anal sphincter muscle is continuous superiorly with the smooth muscle, with the circular muscle layer of the rectum. And the internal anal sphincter muscle is controlled by the autonomic nervous system, supplied by the autonomic nervous system, that is not under voluntary control. Thank you for your attention. That's all for this one.